It looks like on our end that we are live on Facebook. So I'm going ahead and letting you know that. um, Welcome to my guest, Maria Skinner, who is the Executive Director of the McCall Center in Torrington. And I'm going to let you actually start by just telling us a little bit about what the McCall Center is and
Sure.
what it does.
Yeah, sure. Hi, and thanks for having me. I'm Maria Skinner. I'm a licensed clinical social worker and executive director at the McCall Center for Behavioral Health. And we are a nonprofit behavioral health treatment center, and we focus on prevention. So lots of work with children and families and communities, recovery, and community. And we serve all of Litchfield County, and now with a recent affiliation with another organization, we serve all of Western Connecticut. So Danbury, Waterbury, and the whole western part of the state. We do also do lots of programming in Canton, have done some presentations and partnerships in Avon and Simsbury as well. And there's no shortage of need. Certainly. And so we work with a lot of our sister organizations to make sure that the safety net is there and strong for communities.
And I know that your background was that you had piloted some parent programs prior to this. So can you talk to just a little bit about some of those programs? Because I believe they're still going, right?
Oh yeah, yep. So for a long time, I worked with young people and families, and a lot of the work that I did was with parents, some who would voluntarily come and say, I need a parenting class, there's a lot of stress and I just need some kind of helpful ways to get through, the tough teenage years or whatever it is. And then I also had a lot of parents that would be referred through the Department of Children and Families. And that's really kind of foundational to how I came to understand some of the compulsive behaviors that are harmful, that I think for a long time to a person, because I'm not a person in recovery, but so somebody who struggles with addiction or somebody who struggles with anything that from the outside looking in would be perceived as, it's illogical. Why would you put something in your body or do something that you now know is bad for you, know you shouldn't be doing? So to kind of continue with that story though, so I would work with these families, and they were lovely and they were earnest in their desire to want to be the very best parent they could be for their kids. And they would do all of the homework, they would fill up the workbooks, they would, we would have role play and practice in the moment with their kids, and they would do beautifully. And then they would go home and life happens. Mm-hmm. And either, things are piling up and they're late for the bus, or their kid is screaming at them or kicks them or doesn't want to go down for their nap, or they get a phone call from somebody else that sends them into a place, and then they would say something or do something and they knew that it was harmful to their kids. And they would come to me in tears and say, I did everything you told me to do. And yet here I am, and I'm crying myself to sleep, and I'm a terrible mom. I'm a terrible dad, and I'm not the person that I want to be. And it was heartbreaking. And then you scratch the surface of that and you recognize that almost every single time what drives those kinds of behaviors, where it's like a switch is flipped in our brain and we're not using the prefrontal cortex anymore. We're using like a much more primitive part of our brain, and we're reacting from that place. And that's because something has triggered an old trauma in us. And we're now in this fight or flight frame of mind, and we're never our best selves when we're in that place. And so we had to go deeper and help parents to heal from those old traumas, which is not as scary as it sounds, because there's really good and effective trauma treatments because people get really scared. Like, I don't know if I remember, I don't know if I want to talk to anybody about that. I remember, like, when I was in training to be a therapist, I remember a professor saying, okay, I want everybody to think about your deepest, darkest secret. now share it with everybody.
Right.
And she
Pass
was
it
like,
on.
okay, now hopefully that gives you a little bit of, sensitivity to how hard it is for somebody to open up to their therapist. So there are ways that all of us can address those old wounds and heal from them with the help of a therapist that's really effective. And so we don't transfer that hurt and pain onto other people. And a lot of times people hurt themselves. So that's sort of, that's where the root causes of addiction come into play, is that.
Well, and that phrase, hurt people. And
Yes.
sometimes the people they hurt, like you said, are themselves.
Exactly.
And so you find, root causes of addiction, or you find, root causes of other things as well. And so I would say that some of that work obviously led you to the work that you're doing now. And I know that at least I've read, and I know other people have read, we know we're in an opioid crisis, and we have been for many, many years. I don't know many people who don't know personally someone who has been touched either by an addiction or an overdose or both, people who've lost family members. I certainly hear it a lot when I'm, calling and reaching out to voters. I heard it a ton in 2018. You're very familiar with Canton and Avon, so you know some of the challenges we have in this community. So I guess I would say, how did you get to the work you're doing now with that? And then also, what have you seen in terms of where we are now with addiction, especially in light of the pandemic?
Yeah.
It's a lot.
So I became executive director here at McCall in 2013, in December of 2013. And that was right when we were watching the numbers just climb and climb. And what we said, and this doesn't sound like anything novel these days, but in 2013, we were looking at this as a public health crisis. And I think, it's not that long ago, but that was sort of, considered progressive thinking back then.
Hard to believe, right?
I know. Well, that's a good thing, because we've come a really long way. And I think that's because of what you said a few minutes ago, that every single one of us has been touched in one way or another by this. So, so I think when it's happening to someone else, it's hard to sometimes recognize that this is a public health crisis and not something that somebody did to themselves, So, but I think there's been a much deeper understanding over the last 7 or 8 years. So at the same time that I became director, we were noticing this trend. And so we put together the Litchfield County Opiate Task Force, which is a public health solution to that issue. And so that's every single sector in the community is represented. So there's people in recovery, there's sober homes, there's doctors and first responders, and everybody who says, this is impacting me and I'd like to be part of the solution is welcome in that work. So that's then been a real avenue for advocacy around policy and change. And so I think through that then is probably how I came to be part of the Connecticut Alcohol and Drug Policy Council. I co-chair the treatment committee, which is a legislatively mandated body that makes recommendations for change in policy. So there's been a lot of good progress and work. But at the same time, the potency, with the advent of fentanyl and other analogs, it's so much more deadly. So what used to be, we know that addiction is a chronic disease that involves relapses. And so when that used to happen, somebody would say, okay, I know, I need to get back into therapy. I need to get back into treatment. Today, what it could mean is that person's life is over. And so really putting every single resource and effort into addressing this from every angle is what we're doing, with my organization, with the task force, with that legislative body, the Alcohol and Drug Policy Council, conversations with lawmakers, everything that we can do.
Absolutely. So I guess in terms of that as well, a recent story when I was speaking to someone was that, the daughter had become addicted and actually wanted to get help. They went to CCMC. They spent 2 days in a hallway because they were waiting for a bed. And so what are some of the things, you hear that story over and again, we were waiting for a bed. We were waiting for this. We were waiting to get into a treatment program. Is it just that the system is so overwhelmed? What else is there that could be done to get families, the help they need when they need it?
That's such an important and good question. And I think, we still have a siloed system. As much as we've done and as much progress as we've made, I think especially for adolescents who are in crisis, whether it's mental health or addiction, we don't have the number of resources that we need to be able to meet that need. And it breaks my heart anytime I hear that there's a child in crisis who can't get help immediately, because what we know also is that it's a life-threatening disease.
Mm-hmm.
And so we don't do this in our healthcare system with any other life-threatening disease. We don't ask, people to wait,
We'll get you that insulin in 24 hours.
Right. We don't do that.
Yeah.
So I think, prioritizing and recognizing that that this is a life-threatening illness, and that we can and must meet people where they're at when they need that help, is such a critical, important, top of list priority for me.
Right. And there's no easy answers. I mean, that's the reality. And then also, we've seen certainly in terms of the incarcerated population, I think that there's, I had read a study recently that said that 50% of abusers have at some point in their life been incarcerated, and the difference that makes. Maybe you can speak a little bit about sort of where that is as well. And it's, I think that, unlike the crack epidemic that we had, when we were a lot younger, like you said, I think that this is hitting everybody everywhere, in terms of, someone, or someone who knows someone, or that someone is you. So.
Right. There's a lot of, the way that I look at that is kind of if somebody interfaces with the criminal justice system, whether that's an adolescent or an adult, that's an opportunity. So too is somebody who goes through the emergency department with a non-fatal overdose, or has an interaction with a police officer on the street, or any number of places where the system in its totality has a touch point with a person who's struggling with addiction. That's an opportunity for an effective intervention.
Mm-hmm.
And I think because the people who struggle with addiction are marginalized and misunderstood and maligned, and we other them, and we say this is a choice and this is your fault. And also, I think some of those systems have traditionally been under-resourced. So for example, you have an interaction with a police officer. The police officer has come across this person, let's say it's a 25-year-old guy, and he's had to Narcan him 3 times in the same night.
Right.
That officer doesn't have a social worker or a case manager or a recovery coach, a peer, that they can call on. So they have sort of only 2 tools in their toolbox. They Narcan them or they arrest them.
Right.
And so then that means that they're now experiencing frustration, anger, sadness.
Right. Your own version of trauma. Yeah.
Yeah, exactly. And so we know, in communities around the state, we're working with something called PARI, the Police Assisted Addiction Recovery Initiative, so that there can be a person who has an expertise in addiction, a person who has an expertise in mental health, and that now the resources are there for a really good outcome, because it's an opportunity. Same with emergency departments, where there's recovery coaches in almost every single emergency department. People can be inducted onto medication-assisted therapies after a non-fatal overdose. All of these things I think we're learning, and there is a criminal justice committee of the Alcohol and Drug Policy Council that's done tremendous work about around making sure that people have access to treatment while they're incarcerated. There's also the Treatment Pathways Program, where somebody can be diverted completely from being incarcerated if they pass through that screening and agree to getting treatment. So we're making good progress. We just have a long way to go.
Right. And because the reality is if you're harming yourself, that's not, it's a crime unto yourself, but it
Yeah.
really is not a crime.
Mhm.
And the more that we can address it in a way that makes sense and that actually leads to that road to recovery, that's what we really want to see, of course, better outcomes for everyone. So I know that, there are probably a lot of parents watching. There are parents who are trying to figure out ways to talk to their children. I know that I had a very frank discussion with my daughter before she went to college and said, like, this isn't, I hate to say it's not your, grandparents' marijuana, but when you hear about, how drugs are laced and how you can't just do, and it's often an awkward conversation for parents to have. The schools, do a pretty good job of educating, but what are some of the things that parents should be talking to their kids about in terms of opioids and the crisis and addiction?
Yeah, it's such a wonderful question because I think, a lot of parents talk to me about vaping. They talk about, is how dangerous
So
is
addictive.
marijuana? If
Yep.
And I think young people have a much lower perception of harm around marijuana because of a lot of push towards really normalizing that. And when perception of harm goes down, we see incidents of use go up. But I think the conversation really is about what's driving that choice. So kind of along the theme of our conversation, is that person struggling with loneliness? Are they struggling with anxiety? Is there, are they wrestling with some depression? Like, because in order for any of those compulsive behaviors and addiction to really take root and take hold, it's serving a purpose for that person. It is relieving some very uncomfortable feeling and taking that person out of that pain for a little while. So those deeper conversations about what's driving behavior and when and where do you feel safe? When and where do you feel comfortable? What helps you to feel happy? How do you cope with pain, discomfort, feeling, scared about coronavirus or not feeling connected because you're
Doing
taking
this
your
all the
classes
time.
over a screen.
Right.
Yeah.
Right.
And let's have those conversations because we know that those are the things that drive that behavior to reach for a drink or a drug.
Right. And I think other behaviors as well. I'm not sure, in terms of, it seems that eating disorders are on the rise right now. It seems that you're hearing a lot more about young people cutting themselves on the rise. And so I think it all feeds back to that same, what is the impulse that's causing that or what is, so do you work with those as well at the Behavioral Health Center?
Yes, we serve adolescents as well as adults. Our inpatient and residential programs are all for 18 and older, but we do have outpatient programs for adolescents. And we do a lot of work in the schools and do prevention and early intervention. And those are the conversations exactly, Eleni, that we're having is, what's your go-to when you're uncomfortable? Is it food or is it self-harm? Are you denying yourself?
Yeah.
Because the world feels unsafe and this is something that you have some control over. And so getting some healing and resolution around those deeper issues is where we go. So it's interesting because people always wonder, like, what is treatment like? We don't spend a whole lot of time actually talking about the chemicals because that's not what addiction is about. It's the story we've been told since the time, I think all of us can remember going back to elementary school. But that's really not what addiction is about. And eating disorders and all of those other compulsive, self-harming kinds of behaviors have the same foundation.
Yeah, it's so interesting because I think that being the generation that we are and the generation just above us, I mean, certainly alcoholism ran in my family generations deep, and you did not. I mean, here I am talking about this on Facebook. That was not something you said outside of your home.
Right.
I was lucky to grow up in a house where that was not an issue, but it was an issue for the generation above, and it was very prominent and led to many other things. As you know, it leads to joblessness, it leads to abuse in the home, it leads to all of these other things. But I'm grateful that we do seem to have more access to the information. But in regards to that access, we know that we've got telehealth covered through, March, and that's a wonderful thing. What kinds of, have you done a lot of telehealth? And I'm thinking in terms of the equity around healthcare. It really is not equitable, and the access is so critical because the people who need it the most are not receiving it. I can go call and get a therapist tomorrow, but that's not the case for so many people. And how does that work for you guys? And what are some of the things in your head around that?
Yeah, what a great question. And you're speaking right to my heart now, Eleni. So I think it's really important for people to know that it has actually never been easier than right now to get access to behavioral health care.
Nice.
You can do it from your phone. You can do it from a screen. And any nonprofit, and it's easy to kind of tell, but if you go to the Connecticut DMHAS website, DMHAS, there's a whole list of every organization, and we all are doing telehealth. And nobody gets turned away because of an inability to pay. So we get some grants from the state of Connecticut to make sure, and as soon as you pick up the phone and make that initial call to say, I don't know exactly what I need. I just know that I have some questions. I might have a problem. I'm not sure. Or my kid may have a problem, my husband, whatever. Can you tell, where do I start? And then we walk you through that. And it's, I don't mean to make this a commercial about McCall. We work in lockstep with our sister agencies. I think the most important thing is that somebody calls. And never let, the insurance card in your pocket or your bank account be what stops you from doing that, because the nonprofit healthcare system is the safety net. It's also, they have highly trained doctors and clinicians, therapists to be able to help people. So, and private practice therapists are great, but we have marvelous therapists. So I think, that's something that from an advocacy standpoint, we have to fight for all the time, because I think, people look at different line items in budgets, and those grants that make sure that the safety net is there are always in peril. They're
always.
Yeah. So it's important to have these conversations so that people know what those dollars actually do.
Absolutely. And mental health it tentacles out is the way I think of it, in terms of, being able to keep a job, staying out of poverty, staying, under, not to be homeless, all of the things that go with that. And so I think that, I'm great. It's really interesting. I talk about this a lot, but the pandemic has been such a crisis and such an opportunity, because I think the things that it has laid bare and the things that we have had to be creative about to make happen. I mean, telehealth, I was working for an organization, it was a military medical publication 20 plus years ago. And I was out interviewing all these military folks about telemedicine. And so it was sort of in its infancy, mostly because we still had dial-up, and you remember those horrible noises. But the point being that we have come so far, except that there has been this sort of barrier to using telehealth. And I know we've taken advantage of it with the pediatrician and with the orthopedist, and but I think that sometimes people forget about taking advantage of it in terms of your mental health. And I don't think there has been a more critical time than this year to take care of your mental health, because we see the quarantine fatigue, and we see how hard it's been on families, and especially on seniors. My goodness, our seniors have just been, we know when we're calling and reaching out, it is heartbreaking, even just calling my grandparents, who my parents are seeing them regularly, but my grandmother talking about how lonely it is, and because it is lonely, and certainly with it, I believe it's Suicide Awareness Month, and these are things that we have to be constantly thinking about. And so I'm grateful that telehealth, at least so far, has been extended through March. I certainly hope it gets extended further.
So too, it's been great to offer people the choice, because it really works well for a lot of people, and it doesn't work for everybody, and that's okay too. We're probably about 35% in person, so we can do groups and individuals. in person and just do that in a safe and distant way. But a lot of people are really comfortable with the telehealth. And so it's a great option for folks.
Well, and that again speaks to equity, because if we need
Yes.
to have universal everyone right? So that way, if everyone had access to broadband, then they would certainly have more access to services as well.
You're here.
Yeah,
Yes.
so we have a lot to work on, that's for sure. So I want to make sure that before we finish, we will be putting some resources in the comments, just because I know that a lot of times people go back and watch our Tuesday talks after the fact, and I feel like, especially with a talk like this, you just never know who is going to want to reach out for help, or that this conversation might change their mind on something. Now, I know you also I believe you've worked with the Lions Club locally in terms of that partnership. Do you want to just speak to that, because that is something sort of hyper local for us with the
Yeah, I'm a Rotarian. Actually, the meeting that I have right after this is I'm president of the Torrington Winston Club.
Oh, wow.
And so but I live in Canton, and so I serve
we'll still take you.
I serve on the Canton Youth Service Bureau board. And so Bob Bessel came in one day a couple of years ago and was talking about his passion for prevention and was talking about the opioid epidemic. And so I said, the Rotarians
Canton has been hit pretty hard.
I know.
Very sad.
And Bob's got a heart of gold, and he's a Lion. And so we started talking about teaming up between Lions and Rotarians to create this addiction task force. And so I co-chair that with Heidi Zachara from Avon, who is a Lion. And so we were able to really roll out this whole initiative, which is for people to take any unused medication, lock it up until until it expires, or when you're done with it. Don't keep it around just in case.
That's right.
And dispose of it. And you can use the drop box at the police station in Canton, or you can use a doTERRA bag. So the Rotarians and Lions were making sure that doTERRA bags, which is a little like Ziploc pouch with some chemicals in it, and that effectively gets rid of that medication and makes sure that it doesn't fall into the wrong hands and get diverted and harm somebody.
Right. Yeah. And that's a huge thing. I especially think, not just parents, but our seniors, we certainly don't want people taking expired medication, but additionally, you don't want people over medicating. You don't want people taking medications they shouldn't be, mixing it with alcohol, et cetera, et cetera, et cetera. So I think it's just such a great program that was put together. And certainly, it's nice to have some place that you can, take your medicines and safely dispose of them. That's so critically important.
Yeah. Thanks for asking about that, Eleni.
Well, it's one of those hyper local things, but it matters because for a long time we didn't have any place locally that we could do that. And actually we still don't have a drop box in Avon. So something to work on. It's on my list, but it's one of those things that at least, Canton has been on top of it. And it is, I will tell you, it is challenging. I mean, I hear it over and over again from voters, what are you going to do about this? Or what, you're running, what are you going to do? And how are you going to work on this? And what do you think about this? And it is hard. I can remember in 2018, knocking a door, and the woman came to the door and she had her son's face on her shirt with his birthday and his death day. She had moved him out of one town to Avon because she was trying to get him away from that crowd. And he did well for a while. And then unfortunately, he passed away because he overdosed. And I think back to, all the people that I knew, unfortunately, very, very good friend of mine when I was just graduated high school. It was an LSD issue, something that you hear much more about other things now. But by the time he was 17, he'd already been to rehab 3 times.
Yeah. Wow.
And clearly that is a disease. I mean, that there's no way you can look at that and think otherwise. And I think that that's part of this great work that you're doing, is helping people really understand addiction as a disease. And I'm so grateful that people like you and centers like McCall exist, because, families, individuals, everyone really needs help. So it's good to have you.
Yeah. be here. Really
Thank you
appreciate
so
the
much. So I
opportunity.
really appreciate your time. Like I said, we'll put some resources below so that we make sure that everybody has access to the information they need. But thank you so much for today. And I wish you well at the Rotary meeting. You guys have a really nice time of the day. Ours is crack of dawn.
I know. Yeah, you guys are, I've been to your meetings. They're
Bright and early.
nice. Yeah. Non-pandemic, some good breakfast and
Yes, absolutely. Yeah, we miss
get
those
the work
breakfasts.
done. Yeah.
So, well, thank you again. I really appreciate Maria, and thanks for all the good work you're
Thank
doing. And
you.
I hope to hear more from you and
Oh,
very soon.
great.
Thanks,
Sounds
Maria.
good. Take care.
Okay, you too.